Are you a busy woman who prioritizes everyone else's health above your own? Do you have questions about your diet, exercise, or how to prevent or treat certain health conditions? Are you always Googling health questions that you forget to ask or are embarrassed to ask your primary care physician? Girl, do you even have a primary care physician? Well, welcome to Headed to Healthier. I'm Dr. Brittney Anderson, a board-certified family medicine physician, and every day in my private practice, I have discussions with women just like you who are doing their best to juggle the demands of life while also desiring to become healthier. Inside this podcast, you'll find practical and actionable health tips that you can incorporate into your daily life. You'll get expert advice and insight from some of my awesome healthcare colleagues, and you'll hear relatable conversations with incredible women just like you who have made their health a priority and are thriving because of it. So throw on your sneakers and get some steps in while you listen. Or if you're driving, get those hands at 10 and 2 and let's dig in. We are headed to healthier. Hey friends, welcome back to Headed to Healthier. Today we're going to talk about something that I love. That is simple, doable ways that you can reset your health before we step into 2026. Now I know the end of the year gets so busy. Holidays are here, we've got family events going on, we're traveling, we're trying to wind things down for the year at work. But this time of the year also gives us a natural pause point, a chance for us to stop and check in with ourselves. And the great news is you don't need perfection. You don't need a Monday. You don't have to wait until January 1st. You just need a moment of intention. So today, I'm going to share with you 5 practical ways that you can reset your health before the year even ends. And at the end of this episode, I'm going to tell you about a tool that can help you put all of this into motion. Spoiler, it's the 2026 Healthier Planner, but we'll get into that later because it really was literally designed for this kind of reset. Let's get started. The first step is one of the things that most of us know we need to do, but we keep putting it off, and that is get your preventive care in order. What that means is schedule your annual checkup, get your screenings, whether it's a mammogram, a pap smear, colon cancer screening, a DEXA scan, whatever it is, get that screening done. Or maybe it's that you need to catch up on labs or get vaccines in. Here's what I tell my patients. Even if the appointment ends up being in 2026, go ahead and schedule it now. Be proactive. Your future self will really thank you for that. Because preventive care lets us catch things early, and it gives you this peace of mind of knowing exactly where your health stands. And honestly, there is no better feeling than going into a new year knowing that you're not starting off already behind on something important. So take a little bit of time and go ahead and start scheduling those appointments. If you can get them done before the end of 2025 as we're listening to this episode, or whatever year you're listening to this in, if you can get it done before the end of the year, fantastic. But if it is in the new year when that is scheduled, that's okay. Just get it on the books. The second thing you can do is do a health baseline check. Now that is a reset that may take you about 5 minutes to do. And what I'm talking about here is get those important numbers and write them down. And they don't all have to be numbers. It could be that you're tracking your weight or how your clothes are fitting, your blood pressure, your average steps in a day or what your movement minutes are like in a day. It could be you jotting down what your sleep pattern is like or what medicines or supplements you're taking. And this isn't about judgment, it's about awareness, because when you have a baseline, when you know what point zero is, you can stop guessing. You know where you're starting, so you can actually make some progress instead of just hoping things get better. So many of us say, oh, I want to be, healthier. I want to be more active. But you've got to know what your baseline is at point zero in order to know where you're actually trying to go so that you can look back later and see, did you actually make some improvements? So a baseline really does give you clarity, and then clarity gives you power. Now, the third thing you can do is pick one area of your daily routine and simplify it. Now, that is something that I'm working on so much. And, you don't have to pick a million things. Pick one. Pick one thing. Here's some ideas of things you can do. Set a regular bedtime. Add one fruit or vegetable into your day every day. It could be that you take a 10-minute walk. It could be that you add a 3-minute breathing or mindfulness pause. It could be that you drink, 2 glasses of water before you get your day started. It doesn't matter what it is, but pick something that is already a part of your daily routine and simplify it. The goal isn't perfection, it's creating one small win that really builds momentum. And then when you get in the habit of doing that one small thing, then you add one more thing to it and one more thing. We overestimate what we can change in a week, and we underestimate what tiny daily actions can do in months. So just pick one thing and make it easy, and you will be shocked when you look back later and realize what big changes you have made by doing these small things. The fourth thing you can do before we get into the new year is declutter your health to-dos. Now, this one might sound simple, but it can change your entire mental load. Most of us have a running list in our heads of things we need to do. We need to get our prescription refilled. We need to call the doctor's office about a bill. We need to go by and get our labs done. We need to get new walking shoes. We need to order new vitamins. We need to check our insurance benefits. All these things that are constantly running in our mind, but we never actually put them down on paper so they don't get done. So I'm asking you to write all these things down, get it out of your brain, and then commit to knocking one or two of them out this week. This is something that you can do at the end of this year to start you off in 2026 on the right foot. Because when you reduce all that mental clutter, what you're really doing is creating space for better and healthier decisions later. And this step alone can feel like a huge reset. So really take some time, think about all those things that you need to do related to your health that may not just specifically be about scheduling appointments, but other things that you need to do, and start crossing those things off the list because you've done them. And number 5 on this list of the things that I believe you can do to have a healthier year in 2026 is to set one simple health intention for the next year. Now, I'm not talking about a resolution. I'm not talking about an all or nothing goal, an intention that points you in the direction you want to go. So maybe you say, I want to improve my sleep. I want to walk more days than not. I want to eat in a way that supports steady energy. I want to strengthen my body. I want to reduce stress. So I'm not asking you to necessarily set a goal. I want you to think about a health intention, something that is going to guide your entire year. And it's important to choose something that really feels aligned with the version of yourself that you want to get to in 2026. Because remember, clarity beats complexity every time. And so often we make things so complex in life, not just related to our health, but in our entire lives, when we don't take a little bit of time to sit down and get some clarity around that. So take a pause and think about what intention you want to set for 2026 as it relates to your health. And when you think of it, write it down. So let's recap those 5 ways that you can set your health before 2026 even gets here. Number 1 is get your preventive care up to date. Number 2, do a simple health baseline check. Number 3, clean up one daily habit that you have. Number 4, declutter that list of health to-dos that you have. And number 5, set intention for the new year. And if you're listening to this and thinking, okay, doc, that sounds great, but I need a place to write all this down. I don't want to have a million scattered pieces of paper. I need to be able to track this intention that I choose for the year and see how I'm getting there. I need to be able to track my steps. I need to be able to do all of these things. Then don't worry. I've got something for you. That is exactly why I created the 2026 Healthier Planner. This planner has a place where you can track your preventive care. You can list all your medicines and the supplements that you take. You can write out your monthly health goals that get you towards that health intention that you're picking for the next year. It's got habit trackers in it, daily structure, so it's like your regular daily planner where you can put the things that you've got to do to get through your day. But what I love about it is that it has a specific focus on health, a place for you to prepare for your doctor's appointments that are upcoming, a place for you to jot down notes about those appointments, a place for you to put your personal medical history, surgeries you've had, and a place for you to track your family history. It's designed to actually do the things that we talk about in this podcast, because I don't want you just thinking about these things. I want you putting them into action. So if you want 2026 to be your most intentional, healthiest year yet, grab your planner. You can get to it by going to healthierplanner.com. And I'll make sure that I'll tag the link in the show notes. But again, it's healthierplanner.com. Thanks for listening. And as always, I'll be here next week for another episode of Headed to Healthier. Hey, thanks for listening in today. I hope something you heard in this episode will help you on your journey to becoming healthier. Remember, this podcast offers general health information. I am not your personal physician. If you need advice that is specific to you, be sure to consult your physician. If you enjoy this podcast, please consider sharing it with a friend and reviewing it on Apple Podcasts. Also, be sure to subscribe to the show so you never miss an episode. Tune in next week for another great episode of Headed to Healthier. Until then, take care of yourself. Talk soon. Bye.